manager. Don't believe.
Thank you, Mayor. I do not have a report today.
Okay, thank you, Jennifer. We're on to item 3.3. This is the San Jose Animal Care and Services Audit Report. We will begin with a 10-minute, roughly, presentation led by the City Auditor, Joe Royce.
Good afternoon, Joe Royce, City Auditor. I'm here with Gitanjali Mandrakar, Abele Obe, and Michelle Malari from my office to present our audit on animal care and services, addressing capacity constraints and updating shelter protocols will help improve animal outcomes. Also in the box are Matt Lesh and Kiska Eichardt from Public Works and Animal Care and Services. Opened in 2004, San Jose Animal Care and Services, or ACS, is a full-service animal shelter providing services to San Jose, Cupertino, Saratoga, and Milpitas. The shelter provides various animal-related services such as animal licensing, adoptions, stray animal intake, medical services, and field response for animal-related issues in the community. ACS's 2024-25 adopted operating budget totals $15.4 million, which supports 94 positions including veterinary staff, animal care attendants, administrative staff, and others. The overall budget and staffing has increased in recent years. ACS is operationally divided into 4 sections: medical services, shelter operations, field services, and administration. Among the 94 positions that I noted at the time of the publication of the audit, ACS had 5 vacancies. In October 2023, the City Council directed my office to conduct an audit of ACS because of community concerns about shelter operations and the high number of animals in the shelter. Audit direction included a comparison with industry standards for animal care and veterinary services, reporting of shelter data and metrics, relationships with rescue groups and volunteers, licensing, vaccinations, facility design, and services provided in neighboring jurisdictions. We had 8 findings, and the first finding is that the San Jose Animal Shelter is over capacity and needs a long-term strategy to address the demand for shelter space. We found that the on-site animal population has frequently exceeded the ACS housing capacity, which has impacted the shelter's ability to provide daily care to shelter animals as well as staff morale. Point-in-time counts in July and August showed that there were nearly 700 animals on site, while shelter capacity was roughly 500 animals. At the same time, the average length of stay for animals has increased in recent years, and due to capacity constraints, ACS has lacked space to prevent disease spread and promote animal welfare. We noted that animals have been housed in areas that were not intended for long-term housing. Also, based on ACS estimates and industry standards for time spent on daily tasks, when over capacity, care attendants would not have enough time to meet the needs of all animals in the shelter. For these reasons, the shelter should develop a multi-pronged strategy to address the supply and demand for shelter space in the context of their overall budget and staff availability. As part of this strategy, ACS should continue to expand active population management efforts, including such actions as diverting kittens from intake, increasing opportunities for adoption and rescue, and expanding spay and neuter services, among others. In this finding, we have recommendations to determine current shelter capacity and assess whether additional kennel space is required, reassess the kitten nursery to divert kittens from the shelter, and formalize pathway planning in the shelter and increase opportunities for adoptions, rescue, and spay and neuter services. The second finding is that improvements in animal care protocols and record keeping will enhance shelter operations. ACS protocols generally align with Select Association of Shelter Veterinarian, or ACS, guidelines. However, there are areas where ACS can update its internal protocols and ensure staff is appropriately trained. We found that the ACS manual is outdated and does not align with actual shelter practices or ASV guidelines, in particular around disease management and some daily care activities. Record keeping at the shelter was also not always complete, making it difficult for supervisors to assess whether animals' daily needs are being met. And lastly, updated procedures to track and access supplies can improve inventory management. So we have recommendations to update the ACS manual to reflect ASV guidelines in various operational areas within the shelter, providing ongoing training on shelter protocols, record keeping, inventory management, and defining supervisory responsibilities over shelter operations. Finding 3 is that additional disaggregation of metrics and better data management can enhance transparency of shelter operations. ACS makes a large amount of shelter data publicly available through the ACS dashboard and the city's open data portal. We found that additional disaggregation of reported outcomes and other metrics can enhance transparency and provide information about what may be driving trends in shelter outcomes. This in turn can help identify subsets of animals with longer shelter stays or lower live release rates and help ACS management focus efforts on pathway planning for such animals. Better data management can also improve data reliability and transparency for shelter operations. In this finding, we have recommendations to provide additional disaggregated reporting on length of stay and shelter outcomes, and updating data management protocols, including assigning staff to manage data quality processes. Our 4th finding is that San Jose Animal Care and Services can enhance its engagement efforts with rescue groups to improve animal outcomes. Since fiscal year 2018-19, the number of animals rescued by rescue groups has declined by 68%. In an auditor-conducted survey of rescue groups, 40% reported having capacity constraints of their own, which may explain some of the decline. However, only 40% rated their overall experience with ACS as good or excellent, and only 44% reported having received sufficient information from ACS to make rescue decisions about animals. In this finding, we have recommendations to designate a single point of contact or contacts to coordinate with rescue groups, update communications to rescue groups to include complete and accurate information, and develop guidelines for the use of Gift and Guardian Angel Program or GAP funds. For the last item, we noted that clear guidelines would help ensure donated funds are used consistently in the future. Our 5th finding is that improvements in the volunteer program can aid in providing a coordinated approach to care at the shelter. Volunteers at ACS play a role in enhancing animal care through enrichment activities and assisting with other tasks. We found that 78% of respondents to an auditor-conducted survey reported they would recommend volunteering at ACS to a friend or family. However, current training requirements are lengthening, taking over 11 hours, but not all trainings are relevant for all volunteers. Also, the current volunteer management software does not meet ACS or its volunteers' needs, particularly around tracking hours and scheduling shifts. So we have recommendations to assess and update training requirements and make non-essential trainings optional, and consider options for alternative volunteer management software solutions. Our 6th finding is that licensing compliance and access to equity-based services can be improved. The municipal code requires that all dogs and cats be licensed after being vaccinated for rabies. The code also requires that the term of the license align with the length of the rabies certificate. However, we found that in March of 2024, almost 60% of active animal licenses exceeded the validity of the animal's rabies certificate. We also found that the process for issuing new licenses and renewals is labor-intensive and takes a significant amount of administrative staff time. Other jurisdictions provide low-cost medical services to underserved communities to encourage licensing. San Jose has not been providing these regularly. Although while ACS offers license fee exemptions to seniors, this needs to be done manually, and application forms are only available in English. So we have recommendations in this finding to consider contracting out the administration of licensing, aligning future license terms with rabies vaccination expiration dates, and increasing the availability of low-cost medical services in the context of overall budget considerations. Our 7th finding is that San Jose's Animal Care and Services has begun implementing Maddie's fund recommendations, but work still remains. A 2022 consult report provided by the Maddie's Million Pet Challenge resulted in over 200 recommendations to improve shelter operations. We found that while ACS has made progress towards implementing some of the recommendations, work does still remain. However, in some cases, recommendations may be outdated or not in line with current ACS practices. We have one recommendation, that's to prioritize remaining relevant recommendations and designate an individual to monitor and track them moving forward. Our last finding is that services to contract jurisdictions may exceed those provided to San Jose residents. ACS, as I mentioned, currently provides services to Cupertino, Milpitas, and Saratoga under contracts with ACS. We found that the agreements with neighboring jurisdictions provide a higher level of service than for San Jose residents in some areas. For example, performance targets for priority 2 and 3 calls for service are higher for the contracted jurisdictions. These reflect non-emergency calls, which include animal bite reports, confined animals, investigations, and other incidents. We also noted that revenue calculations for the Cupertino and Saratoga agreements included cost elements that had not been included in the Milpitas agreement. Lastly, tracking activity and costs can ensure consistency in future agreements, ensure they reflect the level of services provided. In this finding, we have recommendations to consider aligning San Jose performance goals with contract jurisdictions and tracking activity and costs, moving forward to determine if revenues reflect levels of service provided. The report has 39 recommendations to improve services and care for animals at San Jose Animal Care and Services. As you accept the report, we're available to answer any questions, but first I'll turn it over to Matt for the administration's response. But first, I'd like to thank the Animal Care and Services Division of Department of Public Works and all the volunteers, rescue groups, and staff over there that talked with us during the course of the audit.
Just waiting for the slide deck. So thank you, Joe. Thank you, auditor team. I appreciate this. I thank you, council, for the chance and direction to get this work underway. I am Matt Lesh. I'm the Director of Public Works, and with me is Kiska Eichardt. She's the Division Manager for Shelter Operations at the Animal Care Center. There are other staff in the audience to help get us some information. I would like to thank all of the staff that supported all of the work. We've been spending a lot of hours with the auditor staff to get through this, and so I'd like to kick in here. So some of this is a summary of what Joe just said, but it kind of highlights in because at NSC I was given direction to come back with a work plan. So some of this feeds, all these slides feed into the initial work plan that we're developing. So as noted, there's 39 recommendations from 8 audit findings in 9 audit areas. 21 we rated as green and 18 as yellow. And often people ask, why are they yellow? The only reason why any of them are yellow was in case as we go to begin them, if we notice anything we have as a gap in terms of budget, if we need to come to council and ask for funding to complete that recommendation. The auditor's office is very diligent in making sure that what means the definition of done. And so sometimes there is a bit of money that's needed for that. And the only reason why is there might be a reason for funding for some of the recommendations. All of the other recommendations we support and accept. We set 4 of them as being done by the end of March, 20 by the end of June, the majority of which be done by the end of the calendar year, and 1 done by the middle of 2026, and only because there is a potential of having an IT procurement piece of that, and those things take some time to get over the goal line. Those are all the sub-recommendations. You notice those don't add up to 39, but they are some of them have sub-recommendations. The themes we heard. The capacity for care needs to be monitored, and it is influencing animal performance. Diligence to the protocols and records will improve our performance and our transparency. Engagement efforts with rescues is impacting our outcomes. Better systems and communication can improve the volunteer program. And licensing and contract jurisdiction review can improve equity of service. One of the things I neglected to note is at NSC was the survey that Joe noted in his slides. This was, we were going to be putting out one of these ourselves at Animal Shelter was, but when Joe was going to put it out, we said, great, have them part of the audit, have it independent from us, and get some feedback from both the rescues and volunteers. So what the rescues said, about 65% of the experience said fair, good, or excellent. 62% want direct outreach from ACS staff, so about 2/3 want direct outreach. The majority don't get enough information from ACS for animal decisions, though 40% have decreased their capacity to rescue over the last 5 years. Now, this is a subset of the 104 rescues that participated with us last year. So we increased our rescue participation last year. So of that 43 respondents, that's some subset, about roughly 40% of the probably of the rescues that actually participated with us last year. What our volunteers think. About 60% thought the onboarding process time was reasonable and easy for them to do the training. About 80% felt informed about the protocols and were clear understanding of their tasks. A little more than 75% were comfortable and knew with whom to communicate, but only 53 felt recognized, and 39% received feedback. Really a chance to grow there. But yet 78% would recommend volunteering at ACS to their families and friends. We haven't been sitting idly by over the last couple of years waiting for this report. Things have continued to improve, and we've invested in things over the last few years. For the care for the animals, we now have twice-a-day feedings where before we were only feeding once a day. We have a foster program for dogs, cats, and underage kittens that has been reinvigorated. Vaccines upon intake when it's safe and it's staffed. We have our vaccines for intake, which was not done before. And our dog play groups have been initiated as a real boon for our dog participants, though it is a challenge to maintain. Our systems have been invested in, dashboards for tracking shelter care so staff can witness their work being tracked and volunteers can witness their work being tracked in terms of how we get through the shelter for the care for the animals, and we can note which things were done at what time. We have a Pet Compass website so that easier way to search for animals for people to adopt, and a rescue page that has started and will be invested in more. We have volunteer medical and kennel observation reporting system that you'll hear a little bit more about in a bit. We've increased services in terms of staffing the overnight shift. Our emergency services collaborations with our emergency management team for the pets with their people during keeping our pets with their people during storm events. And our facilities have been improved with cat portals allowing between the cat kennels, allowing the cats to go between cages when space allows. Kennel tops have been installed in all dog kennels to prevent them from jumping out, which causes lots of fun when the dogs get in together when they're meant to be kept apart for a bit. And dog yards and synthetic grass have been installed for some of the play groups for dogs to get out and run around. And our new foster care center to provide services and coaching and help for our foster parents. The initial work plan. So when this report is accepted by council and direction is given to us, we'll begin immediately tomorrow, and by January, all of our sub-recommendations will have a staff owner identified. Our Q1 OKRs will be drafted for my approval. Task tracking deployed and available for our staff. We'll be working with a tool to track the tasks as we go along. Scheduling and calendaring Q1 2025 stand-ups, progress reports and planning meetings. Our Community Action Committee will identify the roster and seek commitment, schedule 2025 meetings, and draft the first agenda. By the end of each subsequent calendar quarter, we'll grade our OKRs and our progress on each one of our items, and we'll produce new quarter OKRs aligned to the requisite progress toward the recommendation goals. You'll hear updates from us and from Joe evaluating how we're performing along the way. Joe does two already produced reports, which is the open audit findings, one in March and one in September, and so he'll provide his view of our progress of our open audit. And then we'll also, assuming the blue memo gets approved, we'll be coming back to the NSC for an oral update in May. And then in December at our annual report at NSC, we'll talk some more. In the administrative response, I proposed a community action committee to focus on 4 things. The general framework I'm thinking is 7 members with at least monthly meetings, and we'll report out at the next NSC. We're not going to wait until those recommendations. If they're done, we're not going to start and only get them done in December. If they're done early, we'll get them done early. But we'll be focused on 4 recommendations. And part of this is to work with the community, work with our partners about finding ways to improve, increase the spay and neuter services for the community, communication protocol and points of contacts for inquiries, appropriate information that the rescues need. If we have 104 rescues, and if we need to have different protocols for that, you can see what some of that challenge is. How can we hit most of them, most of the time with the best information so they can make decisions? And then we will work for options for free and low-cost veterinary services for low-cost pets. Now, I'd like to address the elephant, or should I say the dog in the room. I will say this next photo, the next slide, might be upsetting to some, but this is the reality for many of our staff and our volunteers. This will only be on the screen for a little bit, so if you don't want to look at it, don't look. But if you want to, look around the kennel, look to the kennel to the side. This image has been used both in media and in sharing and communication with us. This is animal number A1350138. Not the most catchy name, so we have another one. But that animal came to us as a 4-year-old German Shepherd in August as it arrived at the shelter as a stray. It was vaccinated the next day and boosted 21 days later. It was noted that it had some challenges with the stress. And then in September 24th, a vet check was performed, was noted for diarrhea, and was treated for the following week. It was neutered on November 15th and is available for adoption. Let's talk about the photo. That photo was received by us on September the 3rd by a volunteer through our kennel observation system, which didn't exist before. They didn't have a way to directly communicate with all the coordinators and all the staff. And it says, I'm going to take this dog out right now. Is there any way someone could clean this kennel while he's out in the yard, please? It's a direct email to all the supervisors, anybody who's on shift to go and clean that. Now, it came in at about 5 o'clock in the evening, the day after Labor Day. So the timeline in that room, with our systems, we can see what kind of services have been provided in that kennel room. About 8 o'clock in the morning, all the dogs were given fresh food and water. About 2 o'clock in the afternoon, the dogs were provided some enrichment treats, and then about a little while later, all the dogs were given food and water again. That kennel observation came in a bit later. That volunteer, I don't know which one, it could have been the one that put the report in or not, reported that a walk was done. And then a little bit after that, all of the kennels in that room were cleaned again. And so the challenge with this kennel room, is that all of the dogs have to be pulled out because of the way they're all situated. And we'll talk about that in just a moment. And so all of those dogs had to be, and this is, if you could notice, it's like 5, 6 o'clock, lots of staff changing over shifts, and our janitorial crew is not there anymore for the day. And so we need to arrange to get all the dogs pulled so staff can go in and clean them and then bring all the dogs back. And one of the reasons why the shelter population for the day is noted there, we have 170 dog kennels at the shelter. We had 258 dogs that day in the building and another 463 cats. Now, if you do the math, 765. There are other animals there, rabbits mostly, but there were 765 animals in the building for a building that was generally meant for about 465 to 475 animals. Joe noted heavily that we are over capacity. These are the challenges that we meet every day, not just our staff, our volunteers, and these are the reasons why we beg to the community and the rescues to come help us. These dogs need our help. Though a picture can say 1,000 words, I'd rather introduce you to, if Leo can bring up, this is Pumpernickel. This is the dog in the picture. Pumpernickel's had a hard time. He doesn't deal real well with the stress of the shelter, and not frequently time has challenges with the diarrhea. Leo, he's obviously been calm over here for the last couple hours while he's been waiting, but this is Leo. This is Pumpernickel, thank you. We're glad he's healthy. He's available to adopt. He's already neutered. He's already vaccinated, ready to go. So if anybody wants to adopt or rescue him, he's available today and every day. But hopefully he can go home soon. Now, we agree that we want none of these images to be experienced, those situations to be experienced by our staff or our volunteers. And we expressed all the concerns when we see these, and you could see the way we approach by systematically getting at them. We now have systems where volunteers and staff can communicate with us. We record it, we identify it, and then we try to learn and iterate and get better every single time. We appreciate Joe's attention to detail, though there are a lot of recommendations, and most people have said we don't have the gumption to get all 39 done next year. I guess I'll have to prove whether I can do it or not. So thank you very much.
Thank you, Matt, and thank you to Joe Royce, our city auditor, and Joe, your team, for doing a very thorough audit. I want to thank my Brown Act, including Vice Mayor Kamei, Councilmember Ortiz, Councilmember Dwan. We, as I recall, put forward a memo requesting this audit last fall, based largely on our own observations, but really, more than anything, the feedback and outreach from concerned community members. And I think the audit shows that we have real work to do to make sure that we're providing that level of quality care and safe, loving environment for every pet under our care at all times. What I appreciate is both the thoroughness of the audit. I think Joe and the team did a tremendous job of really deeply understanding how the center operates and highlighting very practical recommendations, a roadmap, if you will, for where we can go in the coming months and years to do better, which we need to do. Also appreciate the administration's response and Matt and Kiska and the team taking the recommendations very seriously and outlining the beginnings of a plan. Clearly, we still need to learn more about what resources may be needed, and I have some follow-up questions. I know colleagues will, but glad to see that the administration believes that most, if not all, of these recommendations will be implementable over the coming years, because we clearly have a lot of work to do, and we'll talk about that. First, though, we're going to turn to members of the public. I want to thank all of you for being here. Because we have a full house, as I always do, for large items of significance that draw a lot of public attention and sometimes a lot of emotion, sometimes controversy, a couple of guidelines for everyone's participation here. We will limit public comment to 90 seconds per speaker. We have well over 30 cards. We will be here for public comment for well over 1 hour. You can, if you would like to participate and have not yet done so, you can fill out a comment card. They are yellow cards. That we also have them in Spanish and Vietnamese down here where you see the little plastic boxes at the base of the steps. You can fill out a comment card and drop it in the box. Tony, our city clerk, will call folks in groups, typically groups of 5. You just come down, first one down speaks, the other 4 can wait here in the reserved seats in the front row. Important for the entire audience, everybody deserves to exercise their free speech rights, which means that we need the chamber to be orderly and quiet so that we can hear the speakers and the next speaker can hear from Tony, and we do this efficiently and respectfully. Couple of guidelines related to that. One, whether you feel compelled to cheer or to boo, I would respectfully ask you to find a way to express your support. Many like jazz hands, up to you, or you can shake your head no if you don't, but cheering and booing will become disruptive and we'll have to stop the meeting. I would also remind you to respect the people around you. I see a lot of signs, which is great. They all look great where they are. Please don't hold them up and block the view of the person behind you who wants to be able to fully participate in the meeting. So the goal here is to hear from everyone, exercise everybody's free speech, and not interfere with others' ability to express themselves. So I think I've covered it. Tony, I'm going to turn it to you to manage public comment.
Yeah, I'm going to call the first 5 names. Again, as he said, first speaker to the microphone, and then the others can sit in the front row. I have Mike Wagner, Tara Sims, Nenea Parker, Kay, I think it's Bacon, but it could, stop sharing the timer for this one, and then Ginny Havens. And because your timer's not on the screen, the timer's on the podium.
Good afternoon. My name is Mike Wagner. About 2 years ago, nearly 2 years ago, in February of 2023, I was invited by the Chief of Policy for Mayor Mahan to meet with him to discuss the animal shelter. I brought a number of my animal welfare colleagues with us, and a deputy city manager sat in on this meeting, said he pledged to re-engineer the shelter. And he also boasted that there was no reason why this shelter couldn't become a model shelter. This was nearly 2 years ago. What's happened since? Well, the shelter has experienced some of the most massive cat death in the history of the shelter. In 2023, we saw 538 cats die in the care of the shelter. In 2024, we're at 317 right now. During this time, shelter participation as a percentage of rescue participation as a percentage of rescue collapsed to 6.8%. In 2024, it was 8.5%, despite the pledge by your deputy director to re-engage with rescue. That clearly didn't happen. The audit clearly shows that this management team is in over their head. They have shown that they're not even in compliance with basic ASV shelter guidelines. Speaking of compliance, turn your attention to page 53 of the audit, where your DEA registrant, your medical director, is not in compliance with DEA laws and protocols regarding the controlled substances. Also, page 24, there was no...
Next speaker.
Hi, I'm Tara Sims, District 10. I have a lot of issues with what you were saying in your findings. I actually had to email you directly, Matt, to be able to get somebody to respond to my volunteer application. It took me a year, and I had to email you to even get the opportunity to volunteer. Once that happened, I found out there was only one training for cats and one training for dogs every 3 months. So I can't even get in to actually volunteer to help out. You have an army of people who could help you even with paperwork, even with the rabies vaccine, let alone cleaning, socializing, doing all the things that these animals need. And for some reason, you can't get to volunteer even if you want to. That's all I have to say.
Thank you. Next speaker. I'd also like to call down Rachel Ivanov.
Good afternoon. I'm Nineveh Parker from Palo.
I'm sorry, do you mind lifting the mic up a little? Thank you.
Is that better?
That's better, sorry.
I'm
Thank you.
Nineveh Parker from Palo Alto Humane Society. We partnered with SJAX last year to offer veterinary funding assistance for rescue partners who transfer animals out of the shelter. This was an incentive to offer an enticement to transfer and build those relationships back up. Our partnership with San Jose Animal Care Services aimed to provide residual funding for any veterinary needs that these animals might require after receiving basic care from medical staff and/or the GAP funding. Over the past year, Palo Alto Humane has contributed over $20,000 in grants to facilitate medical costs for rescues taking animals from SJAX, both cats and dogs, and rabbits. However, I've observed several key issues that need to be addressed. GAP funding appears to be primarily or mostly used for basic medical protocols such as fecal testing, blood work. Unfortunately, many rescues are seeking funding for basic medical needs that should ideally be managed by the medical staff. It is my understanding that, and we all know that they are overwhelmed and understaffed, and there's insufficient manpower to deliver adequate care for all the animals in the shelter. Despite the time that has passed, animals are still not receiving proper medical care. I urge you to closely examine the reasons why.
Thank you. Next speaker. I'd also like to call Paula, Lynn L., and Annie.
I worked at SJAX as an RBT for 6 months, following an internship I had there while attending Carrington College. I saw many cases of neglect and patients being inadequately treated for pain, resulting in animal suffering. I wrote several emails about my concerns to the medical director and never received a response. In fact, members of management consistently left work early, allowing the workload to fall on those who were willing to stay later to tend to the animals' needs. One evening, I received an email from my supervisor which said, "Until further notice, you are no longer on the schedule." When I asked if I was fired, she said no, and when I asked why this was occurring, they had no further explanation at this time. I perceived this was because of my emails, which raised concerns about their practices. An excuse that I later heard was that I went to the rescues about Linguini, a cat that suffered severe neglect by the shelter. I had no knowledge about this cat at the time and would also question why that would be a reason to take away my livelihood. After this, I was able to get a meeting with the deputy city manager and shared my concerns about shelter management, but was never given back my hours. Make no mistake, my job performance as an RVT was never questioned until after I shared my concerns with the deputy city manager. I question why they are moving perfectly adequate RVTs when they are already understaffed. I am also not the only employee who has been asked to leave after questioning medical management.
Thank you. That's your time. Next speaker.
Just a reminder, folks, I'd appreciate it if you would express your support some other way so we can hear from the next person. Otherwise, we're going to be here all night. Thank you.
Thank you, Mayor Mahan and City Council, for letting us speak today. My name is Kay Blom, and I live in West San Jose. The first time I came here with my rescue friends was February 7th, 2023, nearly 2 years ago. We all wanted to alert you to some problems at San Jose Animal Care Center. I think I said something like, I'm not confident the current management team has the skill or knowledge to care for the animals. I think this audit proves that. In 2 years, how many animals have suffered and passed under this management team? Today, you're going to hear more specifics of the challenges that animals are facing. But honestly, council members, it's time to fix this problem and bring in a new management team at San Jose Animal Care Center. Thank you.
Thank you. Next speaker.
Hi, my name is Ginny Havens. I reside in the city of Cupertino, which is also under the jurisdiction of the shelter. The animals, I think, at intake are being told if you bring in a sick animal, they're being told that medical will treat them. And I know of one situation where a friendly stray was brought in because it hadn't eaten for 3 days. Intake said that, it was on a Friday, intake said that medical would treat it. And after 3 days, the person that brought the cat in found it on the adoption site. So they came to the shelter on the Wednesday to ask if the cat was well, and since it's on the adoption site. And sure enough, then they were told, nope, the cat needed to be euthanized because the cat was too sick. So it spent an additional 5 days suffering because it had not eaten and nobody had looked at it. Also, the TNR program is limited to certain members of the community. Not everyone has access to the appointments. I was told by a staff member at the shelter that there are a limited number of people that have access to the TNR. I am a person that does TNR. I've had to go outside of our area to get appointments because I cannot get any at San Jose.
Thank you. Next speaker, also Rosario Consiglio and Rebecca Davis Matthews, come on down.
Audits and committees. How many do we need? Go see for yourself. Go tomorrow. Go someday time this week or next week. Each of you, go. We don't need to be here talking. You're going to see for yourself. I had a pre-written speech about bringing us all together, a nice speech. However, after reading the San Jose Spotlight article, I have to say this. This shelter was opened in 2004. It's been 20 years now. Our city has grown immensely, but not our shelter. San Jose Spotlight reported last year 426 animals died at the shelter and 1,072 animals were euthanized, according to the report. At its peak, the San Jose Animal Shelter had more than 900 animals, more than over double its capacity. One resident said she witnessed the dirty shelter conditions as far back as 2 years ago when visiting in hopes of adopting a dog. This scene is very depressing, and it's been like this for years, she said. The worker who came up gave her a dirty look and was told where the dog would be and go find the...
Thank you, that's your time. Next speaker.
All right, here we are again. The recent audit confirmed what animal advocates have been saying for years. The shelter's leadership has failed its mission. While the high number of animals in shelters nationwide is a challenge, it's not what's crippling this shelter. The real issue is lack of skilled leaders. Shelter management chose not to follow basic ASV guidelines. They cut long-standing partnership with rescues. They failed to establish operational procedures, neglected to train staff, and fostered a toxic work environment, leading to high turnover in both operations and medical teams. They failed to manage inventory, leading to waste. They failed to oversee medical operations, even after hundreds of cats have died in their care. Meanwhile, volunteers have been driven away. For over 2 years, advocates have raised these concerns with both shelter and city management, only to be ignored, dismissed, and lied to. This pattern continues to this day, as we saw at the NSC meeting and in local news stories. Now we're being told to wait until May to evaluate progress led by the same team that has already failed, even though they have received substantial budget and headcount increase. As an animal advocate, I am outraged by the suffering of these animals. As a taxpayer, I'm appalled by the waste. My question to you is this: why are you not?
Thank you. Next speaker. Also, Sasha Gaffney and Elena Gaffney, come on down.
Hello, my name is Annie, and I've volunteered at shelters since I was 10 years old. We promote our city as the capital of Silicon Valley. We pride ourselves on San Jose and how much we've accomplished. Why then do we continue to put our animals and shelter workers in inhumane conditions? Our main shelter is consistently over capacity. Dogs sit in their own feces and deteriorate as volunteers scramble to simply get them out to go to the bathroom. While the care has improved, the conditions are nowhere near where they should be. I have worked with animals since I was little. I know what it feels like to leave at the end of the day heartbroken. To hold a shelter dog that I worked with and loved with their head in my lap as they go to sleep for the last time and feel like I failed them. The community has asked 4 years to go into the shortcomings at the shelter and create solutions. You now have that. You have an opening, an opportunity to look at animals getting adopted and look at the community becoming safer and know that you cared enough to make their lives better, to make the workers' lives better, to make our lives better. You can choose to not fail them. Please do so. Thank you.
Thank you. Next speaker.
Good afternoon. The audit is giving us a false narrative that there is a capacity limitation at SJAX. Per annum intake has dropped from 17,000 animals pre-pandemic to 11,000 animals per annum over the last 2 years. How can there be a capacity problem with a 35% drop in productivity? Has 1/3 of the building fallen down? How are more cages going to solve this productivity issue? There is nothing in the audit to prove that SJAX funding is not being diverted to other departments. For the 4th year in a row, Jennifer McGuire has been failing the shelter. I have a question to ask as a resident. What else is Jennifer McGuire failing to manage?
Thank you. Next speaker. I'm also going to call Mary Jane, I can't read the last name, but Mary Jane and then Cassidy. Go ahead.
My name is Rebecca Davis Matthews. I'm a resident of District 1 and co-founder of Sustain Our Shelters with Mary Jane. Any of my friends in Sustain Our Shelters will tell you I often say, when I used to work at the shelter and then blank blank, that was the most challenging job I've had as an adult and the job where I learned the most out of any job I've ever had. It was a hard job, and I know this. However, I was happy on most days to be helping animals, being involved with getting them adopted, being there when they were being returned to their owners, being part of the solution in the public spay-neuter clinic. I bragged to friends about working in a no-kill shelter. The shelter as it is now is so sad and disappointing to me compared to how it was back then. Kittens and dogs are kept in sometimes filthy back kennels for weeks or months before even being evaluated, not even spayed or neutered. Shelter staff tell finders to set stray animals loose where they found them. The spay-neuter clinic, that went away almost 5 years ago and never came back. And the live release rate, well, the shelter isn't no-kill anymore. This was only 5 years ago. We can return the shelter to its former glory. We need the city to stop ignoring the problem and making excuses and do something. Thank you.
Thank you. Next speaker.
Hi, my name is Mary Jane McCullough. I'm here to speak on behalf of all the cat leaders. We are out in the community. There are a lot. You don't see us because we're out there nighttime feeding cats. I have an 80-year-old lady who feeds cats at 5 o'clock in the morning in downtown San Jose. I feed on the east side. The thing is that the explosion in the cat population because we cannot get TNR at the shelter. And people are coming in, they know I feed, so they actually have taken their animals who they couldn't get to the shelter to get TNR or afford TNR from a vet. They dump them in where I feed cats. So there's been an explosion in the population for that, and because I could not get, I could trap the animals, but I could not get an appointment for TNR at the shelter. So it's been really hard for us. We have to pay for the food out of our own pockets, and it's been tough. So we would like to advocate for the availability of TNR from the shelter, and let people know that that's an available resource for them. Thank you.
Thank you. Next speaker. I'm also going to call Jennifer Flick and Levi.
Good afternoon. I'm a former cat volunteer. I used to volunteer at this shelter from 2004 till 2007. I also ran shelter cat adoptions events at Pet Store in Los Gatos at that time. Back then, the shelter was newly built. We had challenges even then. They had hot water and cold water pipes, and we had to cool water before giving it to cats. Fast forward to today. I see significant changes in our shelter animal population and practices. The shelter processes far fewer animals now than prior to COVID. Yet many animals are sick, stay in the shelter longer, or decline entry. What happens to those rejected animals? Many remain unregistered as found or told to be left where they were found. Small rescues are loaded with desperate requests from public for help. Inside the shelter, there are also deeply concerning conditions. Hundreds of animals receive minimal outdoor time, spending 6 to 9 months confined in kennels without stepping outside. Worse, 50% of shelter animals are currently not spayed and neutered. This used to happen within a week of intake in the past. The backlog leaves animals stressed, prone to behavior issues, and harder to adopt. We all recognize the economic and social challenges.
Thank you. Next speaker.
I'm continuing from the last one. There is less transparency about animals' medical and behavioral needs. Volunteers are prohibited from taking and sharing photos of at-risk animals on social media, a critical tool for connecting those animals with rescuers and adopters. Our rescue has rescued over 20 euthanasia animals through those posts. This is our cat, adopted in 2007. His kennel had personality descriptions posted. This helped us connect with him. Today, visitors walk through the shelter clueless. No information posted on the kennels. How are these simple things no longer existing? We've submitted a proposal to establish a public committee. It's encouraging to hear that this idea has been well received. To our council members, can you please provide clarity today? Have the scope and timelines been defined? Or when can we expect them? How will we receive the updates? To the shelter and city management, please describe the persistent roadblocks to hiring veterinarians and clinics as spay-neuter vendors. High-volume spay-neuter vets can perform 20 to 30 big animals or 50 to 60 small animal surgeries in a single day. Hundreds of shelter animals need these procedures now. This would reduce shelter stress, minimize behavioral issues, and avoid sending unaltered animals to adopters, fosters, and rescues. The city routinely hires contractors and vendors for road work and other services. Why hasn't this been done for animals? We're here for the animals. Let's act with urgency and compassion to meet their needs. Thank you.
Thank you. Next speaker.
Hi, my name is
Cassie. I'm a high school student at Yerba Buena, and I live in District 7. Today, me and many of my classmates, along with volunteers, are here to protest against the inhumane conditions at the San Jose Animal Shelter. The whole purpose of the San Jose Animal Shelter is to protect and better animals. They are literally in the business of helping animals, yet are continuously being irresponsible and doing more harm than good. Animals are dying at rapid numbers and in inhumane conditions. Their deaths are something that shouldn't be happening. Cats and dogs are dying at alarming rates at the San Jose Animal Shelter in their cages, not being euthanized. These animals are dying and having their final moments in the most horrible conditions that we can imagine, and we are trying to bring awareness to these issues. We as high school students have been able to identify these issues and are here today missing time during one of the most important years in our educational career to advocate for these animals. These animals are voiceless and need help. Please help them. You have the power to do something all of us cannot and make change happen. Listen to our voices and act upon our wishes and help the animals in the San Jose Animal Shelter, please.
Thank you. Next speaker. I'd also like to call, I can't read the first name, but the last name is Sprecher, Judy, Anna Spear, and Justin Smith.
Dear Mayor and Council, thank you for doing this audit. We now have documentation regarding the concerns that volunteers, rescue partners, concerned staff, and community members have been bringing to your attention for 2 years now. The audit shows blatant mismanagement and the lack of ability to execute basic shelter operations. Tracking animals, record keeping, drug management, medicating animals, foster management, the list is long. Why do you think that volunteers, rescue partners, concerned staff, and community members should trust that this management team can execute what the audit recommends? Animals are being warehoused, rescue partnerships ignored. Length of stay has increased, overall intake decreased. Live release rate has decreased. San Jose continues to bear the label of being a kill shelter, all in spite of more staff and a higher budget. Animals are suffering from lack of care. Multiple complaints have been submitted to the State Veterinary Board. Hundreds of animals have died in your care, hundreds more than in years past. So this is not normal. Volunteers, rescue partners, community members seek transparency, collaboration, and communication. Since this management team came on board 2.5 years ago, that has not happened. Volunteers are restricted where they can go. They had to sign a reworded contract that prohibits pictures and videos. No other San Jose volunteer handbook has this codicil in it, even the public library. Unfixed animals are housed near each other, which is maddening. Shelter animals are evaluated by untrained personnel and then placed on a euthanasia list. Several this year lost their lives.
Thank you. That's your time. Next speaker.
Good afternoon. Before I start, I'd like to share with the council a phrase, silence is complicity. Now I have a question for you. What would you do if I told you that right now there's a sick kitten slowly starving to death in a plastic tote bin with little holes cut in the side for air? What if I told you that there are dozens of dogs who have been locked in their kennels for days or weeks on end? What about a little bird in a cage who only gets fed when someone's neighbor happens to come by and feed it? What if I told you this was all happening at one person's house? You would probably want to have them investigated, maybe arrested, and tried for animal negligence and animal cruelty. Well, I'm sorry to tell you that this is happening despite reported improvements. These are real-life examples of what is happening at the shelter as we speak. Instead of holding the people running this house accountable, this council has chosen to employ them, call them managers and directors, and pay them over $500,000 a year in salaries. Now we have 39 contributions, but make no mistakes, these are not recommendations. These are fundamental changes necessary to bring the shelter back into compliance with the law. We will be here in 6 months, and we expect there to be tangible, objective progression on these recommendations, and we expect them to be held accountable if not. So I share with you again, silence is complicity. Thank you.
Thank you. Next speaker.
My name is Quinn, and I'm a resident of San Jose. I got involved with the shelter as a kitten foster and a cat volunteer with my mom. I love animals, and I have enjoyed taking care of them ever since I was a child. I was excited to be a cat and dog volunteer and able to help animals. It makes me sad to see how bad things have gotten at the shelter. We went to drop off donations recently and saw kitten and dog kennels that were covered in feces. This was at the beginning of the day. Why were the kennels dirty? I tried to imagine being a potential adopter and coming in to see kittens lying in their litter boxes with poop on them, and I can't imagine that it would make a good impression. I want the shelter to be welcoming again, to be someplace where people want to visit. I want the shelter to be a place that people trust. My generation needs to have an animal shelter that we can be proud of. Thank you.
Thank you. Next speaker. I'm also calling Madeline Anambu and Liz Holtz.
My name is Justin Smith. I'm a system design software engineer, a concerned citizen, and a freelance cat trapper. This audit reflects poorly on the citizens of San Jose. From the report, it is apparent standards of medical care and hygiene for these animals under city care are not being met under current administration. Animals are not being adequately socially conditioned for adoption. Paperwork is insufficient or missing. This has led to increased disease and missed cleaning schedules. The shelter is at least 50% over capacity. The basic requirements of a functional animal shelter are not being met. These conditions will negatively impact public health. This is unacceptable for a world-class city like San Jose with big tech money and access to cutting-edge data analysis to represent itself with such failure. I expect a well-funded facility with reasonable access hours, a clean facility, and well-cared-for animals. Instead, this report indicates the opposite. Animals are mentally and physically ill, living in their own filth. Hours for animal intake have been cut, and the facility is understaffed for being over capacity. Animals are dying at record rates. City pay for key veterinary positions does not match the cost of living and does not attract top talent required to take care of these animals. ACS represents the city we live in. How, when you think about San Jose, do you want to think about how it cares for its most vulnerable animals? You do not want to imagine sad dogs, sick cats, and lonely bunnies and overwhelmed staff. Mismanagement costs the city money. It costs 4 times as much to clean up these problems as it does to properly fund and manage ACS. The suffering animals will end up as a burden on the public anyway, and will be dumped on the streets.
Thank you. That's your time. Next speaker.
Hello, my name's Judy Spiro. I'm from District 6. I just wanted to say a few things about the presentation by Matt. I know that it indicated 7 members, but they didn't indicate who those members were. Are they just internal? Are they a combination of internal, external? We need some objectivity, and I would recommend either a rescue, combination of city, rescue, and community be participating in that. Some other things I'd like to consider is, as a professional operations person, I've created a template, a prioritization list template that has milestones, dates, start date, end date, completed, not completed. I'd be happy to share that template to create their roadmap and work plan, but I also think this needs to be public on the website so that rescues in the community know what the progress is of a lot of the challenges. I would also recommend quarterly surveys with rescues so that they know where some of the work that they're doing is doing it well, what's recommended for improvements, and how do they move forward with those improvements. And then establishing a collaborative space with rescues so that they can voice their opinion. Thank you.
Thank you. Next speaker. Also come on down, Dinah Hayes, Ellen Pham, and Krishna.
Good afternoon. My name is Anna Spear. I'm a resident and taxpayer of the city of San Jose, and I ask the city council to please stop throwing good money after bad at the shelter. The problem with the Animal Care Center is not a lack of funding, it is a lack of leadership. There is no one currently at the shelter who has any training, experience, or skill set for to manage a public shelter management. What you do have is leadership and medical team who does not follow or enforce protocols and procedures. You do have leadership and medical team that treats staff and volunteers poorly. You do have leadership and medical team who puts animals out who are extremely sick onto the adoption floor. And you do have a social media person who deletes posts when the public makes comments that are critical of the shelter. By the way, that is censorship and a violation of the public's First Amendment rights. Madam City Manager, with great power comes great responsibility. For the past 2 years, you have been made aware of the issues that the audit has now confirmed. And you have been more than gracious by giving the shelter plenty of the leadership enough opportunities to make changes. At this point, your lack of action makes you complicit in the poor treatment of the staff, volunteers, and the poor care of the animals. And I would like to ask the City Council, based on the track record.
Thank you. Next speaker.
Hi, I'm Liz Holtz. I'm with the Community and Companion Animal Project. On these staff, some of our comments, we wanted to talk about the targeted dates for capacity of care, demand, and required resources. The audit recommended that ACS evaluate its current capacity under the ASV standard of care, forecast future demand for services, and identify resources needed to meet that demand while maintaining the ASV standards. ACS has proposed a date of December 2025 to provide this information. That date is unacceptable. Understanding and determining the gap between an organization's current obligations and resources, forecasting future demand, and identifying resources required to meet that demand has to be done during the budgeting process. This analysis and data is needed to develop a budget request. ACS should perform this analysis as part of the 25-26 budget cycle. Otherwise, we're going to wait another year to address existing problems that we have been bringing to the Neighborhood Committee for over 3 years. Ideally, ACS should provide its current capacity for care in its December 24 annual report. What can they do now? So, other things, determining demand.
Thank you, that's your time. Next speaker, also Rachel Ivanov, sorry. Wait, hold on. And John Lippelt, come on down. Go ahead. You can go ahead.
Hi, thank you. And yes, here we are again. And I appreciate the council's support and the auditors, as well as the shelter volunteers, the rescues, and everybody else who has come out, and as well as the shelter staff. None of this is easy. This is all honestly heartbreaking. And the point is that reading through the audit, to me, it read like an organization that is struggling, and it is struggling to meet the needs of the community. And again, the needs of the community are not sufficiently identified because it's only looking at the animals that make it inside the shelter. There is a whole world of animals that do not make it into the shelter because there isn't capacity. And none of us want the shelter to take on more than they can care for, but the amount that they can care for is not enough. And we need to be able to do better for the animals that are out there, as well as the ones inside the shelter. So this is an organization that needs more. It doesn't need less. Thank you.
Thank you. Next speaker.
Hi, my name is Maddie Unabu. I'm a current volunteer at the shelter and have been there 2 years. I have been a working professional for 13 years, focused in HR and business operations. Since being at the shelter, I am qualified to walk dogs, run playgroup, and do adoptions. And overall, I'm deciding to speak today because I do not feel that the leadership of the shelter is qualified or capable of taking action. Matt showed Pumpernickel, the dog, What he didn't call out is there are 3 bulls in that kennel picture. Why? If they were taken care of at 2 o'clock, at most there should be 2, 1 for water, 1 for food. What that shows me was extra bulls were being placed in and they were not removing the dog. Furthermore, you decided to bring a dog here to show that he's well and taken care of. If that's the case, I don't know if any of you saw him shaking. That was stress. And so to bring him here for a social media exercise is irresponsible, and I would expect Kiska for you to know better. Overall, I would like for there to be clear actions of deliverable. It is unacceptable for me that we are waiting until March. It is also unacceptable that there's already a committee being listed, that volunteers who are there, who are putting in the time, are not being considered for it. Thank you.
Thank you. Next speaker. I'd also like to call Christopher West and Lynn Bartz.
Just before you continue, I'd like to remind folks we need to maintain order in the chamber so we can continue. I'd also, as a standard practice, we ask people to direct comments to the council as a whole rather than calling out specific members of staff. Thank you. Go ahead.
Good afternoon. I sent in a lengthy email that was a little late, so I sent it out to all the council members individually. I wanted to highlight a couple points. The first being, if you are on a hike or outside in the wild and a wild animal approached you, what would your first intuition say? Would you want to go out and bear hug this animal? You wouldn't. You wouldn't do that because you would consider it ludicrous to do something like that. You wouldn't do it to a stray dog, a stray cat, or even a mouse. But in the shelter system, staff is doing that as part of their evaluation protocol, along with a battery of other tests. And field experts have noticed and observed over 20 years of following through and observing these evaluations. They are not predictive of how the animal will behave outside of the shelter system in the most ideal shelter setup. So why are we doing it in this shelter system, which is not ideal? There is no value add. And then what happens is the staff concludes that these animals deserve to be put on the euthanasia list. Case in point, fosters, adopters, volunteers, community members, and rescues all have a different viewpoint of these animals that have been placed on the euthanasia list by the shelter staff for not performing with these evaluations. It's a tragedy. Thank you.
Thank you. Next speaker.
Good afternoon. I'm John Leipelt from District 2. For 25 years, I've been raising and training service dogs for canine companions. I'm also a certified therapy dog handler, so I have an extensive background and knowledge with dogs and dogs' behavior. In March of 2023, I volunteered at the shelter to be a dog walker. My role was to walk the dogs for 15 minutes. If the dog was lucky enough to receive a walk, that was the only freedom that dog had for the day. The other 23 hours and 45 minutes, the dog was locked in a cage. Shortly after that, there was a parvo outbreak at the shelter, so I was forced to resign my volunteerism because I had a 12-week-old puppy at home, and I didn't want to bring parvo into the house. I was shocked at the conditions of the shelter and the overcrowding of the shelter. I emailed all of you, but I never received a response. I appreciate the audit. I support the audit. There's a lot of work to do. Please support the memo. Start taking action. These animals are crying out for help, and I hope Karma is rescued by Friday before she's euthanized. Thank you.
Thank you. Next speaker. I'm also going to call my last 3 cards: Annie Borders, Dawn Livingston, and Sean.
Hi, my name is Lynn Bartz. I live in District 6. And I have volunteered as a kitten foster for the last 8 years for the shelter. I hadn't planned on speaking today, so I'm going off notes. And I was not interviewed for the audit. I don't know if any of the external volunteers or just on-site volunteers were interviewed, But what I've noticed in the last 8 years is I came in at a time when there was a head vet named Dr. Tiva. That was her first name, and that's what we called her. And she interfaced directly with the volunteers. She held classes and taught people how to do things like sub-Q fluids and all that kind of stuff. And she had a great program. She did a thank you dinner at the end of kitten season. And after she left, I noticed that there was a significant decline over the next several years, and in the last 2 years, particularly, there's no communication. I basically foster and avoid. I go pick up kittens, I drop off kittens, and I pick up supplies, and that's my extent of interaction with the shelter. There's just not enough communication. The fosters don't talk to each other, they don't share ideas, they don't share suggestions with each other. They don't go to classes. They don't share suggestions with the vet staff. There's no way to do that communication. Anyway, communication is the big.
Thank you. Next speaker.
What's up, everybody? I'm Chris from District 6, from Dev's district. Hey, Dev. That's an interesting view we got back there. There's a lot of people that are not in support of the way the shelter's being ran. You know, this kind of reminds me of when Home First came up here and was asking for a bunch of money, and then they had this great presentation, but the public spoke out and had a line of people for that shelter and were like, their shelter services are terrible. So, like, as a member of a shelter, like, I'm just of a different shelter, of a human shelter, like, I see where this is going. Like, this is just like when we had our presentation. You need to listen to the people because the people are speaking about the care that goes on in the shelter services for the animals. I'm glad that they have people that speak out for them. You know, 90 seconds is a lot of time. Thank you guys for coming out today. Oh, especially for the young people. Thank you for coming out and, like, you know, speaking up for things that you believe in, because I think that's very important. You know, thank you guys for your presentation. For you know, the changes that you guys see fit. Like, I was all for it, you know, and then all of a sudden the people spoke, and it just kind of brought me to pause and really listen to what they had to say, that maybe there's some things and some issues that are going on in the shelter that need to be addressed. And I have 13 seconds left, man. I wish I could do, what's that thing they do in the Senate where they yield their time to the next person so they get longer? If I could do that, I would love to do that. Thank you for my presentation. Thank you.
Thank you. Next speaker, and I received another card from Fatima Lubinsky.
As a frequent shelter critic, I think it's ironic that I follow you. And I'll speak on unhoused pets. We frequently have issues with unhoused pets. People don't want to take their pets to the shelter because they're afraid that they're going to be killed. And my guess is maybe as many as 30% of the pets that you get are coming from the camps. And it's because they're not doing enough spay or neuter programs in the camps to prevent the boom of cats and dogs. So if you would reach out more and do more spay and neuter in the camps, we would have less pets going back into the shelter later. So just something to look at, because I know my little Rumpus came from the shelter, and that's where I got him, and now I have 2 other cats that came from camps. So I think 30%, maybe a little high, but maybe 30% of the intake is coming from camps due to the lack of spay and neuter programs being done in the camps. So it's like a vicious cycle that they've set up by not doing enough spay and neuter programs. So just a thought there, and that also unhoused people don't like to take their pets there because they think they're going to get killed when they're sick and injured. Thank you.
Thank you. Next speaker. Also, Tanya Ulu, come on down.
I'm Dawn Livingston. Most of this is actually written by another former volunteer. I personally have 2 dogs that were supposed to be euthanized there due to behavior issues. I've had them almost a year, and they've shown no aggression issues that were noted. It also took me a year to be notified after submitting a volunteer application. Okay, so for staff evaluations of animals, staff that do the evaluations of animals don't have a behavioral certification. A lot of the behavioral evaluations are done without getting the dogs out of the kennel, so fearful dogs are labeled as aggressive and untreatable. This would be valid if they actually attempted to work on behavior modification. Instead, they use these labels to justify the killing of healthy and treatable animals. The relationship of fearful dogs with volunteers compared to staff and management is significantly different. The volunteers spend more time with the animals to make their lives better. They have pretty much no say as to which animals are marked to be killed, even though they spend the most time with the animals and know what's best for them. Contrary to the former management team, these animals are not the animals marked for euthanasia are not networked by the shelter on social media. The volunteers are the ones that network the animals to be rescued on social media so that they're not killed. Animals are only given a few days after being marked for
Thank you. Next speaker.
I'm actually here on behalf of one of the dogs named Oreo, written by Christina Callahan, who had to leave early today. Oreo's intake date was August 8th, 2024. He was rescued on November 11th, 2024. November 3rd. Sometime at the beginning of August, while volunteering at the San Jose Animal Care Shelter, I noticed a black small Shih Tzu mix in one of the kennels. I was interested in taking this dog on a walk, but I couldn't because he was on behavior evaluation. When I inquired about the status of this dog, I was told he was on bite quarantine, but should have been off bite quarantine because 10 days had passed. Therefore, I waited until the next time I could come into the shelter, and I had planned to check on him, which wasn't until the following week. No one had evaluated him yet, and for my second attempt to walk him, I was not allowed to. The following week, I came to check on this little guy again and was made aware that he was off bite quarantine, but continued to be on behavior evaluation. Therefore, I could not take him out. Weeks passed by until weeks turned into months. His kennel card had a handwritten note that read, aggressive. I thought to myself, how could this little one be aggressive? He seemed scared. The shelter estimated this dog's age as 3 to 5 years old. Evaluation dogs at the shelter are not taken out of their kennel at any point during the day. Unless an evaluation dog is in a half kennel, it will not get taken out of its kennel at any point of the day. Suppose they happen to be in a half kennel. In that case, they only get taken out for a few minutes while a maintenance person cleans the kennel, and another animal attendant will quickly leash the dog and take it out for these moments to get the dog out of the way for cleaning. Imagine how traumatic this could be for a dog that it never gets out. Every time I passed Oreo's kennel, I would...
Thank you. Next speaker.
Hello, my name is Fatima Lubinsky, and I'm a foster at San Jose Shelter and fostering over 80 kittens. I'm here to express my deep concern about the shelter's failure to provide adequate care to cats and kittens. Despite our numerous emails addressing the various issues, we have not received any response or any improvement. As a foster, I will point out a few things, but I hope you hear everyone's concern today. Kittens have been euthanized for no reason. As an example, 4 6-week-old kittens were euthanized in October without any apparent medical reasons per their medical record that I requested. Kittens have been constantly underweight and neglected in the back rooms and after sitting in their own waste for weeks, causing them to die due to neglect, not for natural causes. When fosters are taking these kittens, they are on the verge of death, requiring medical intervention, which shelter can provide immediately because of the shortage of staff. The shelter PPE protocol is insufficient as the staff members lack proper training, leading to uncontrolled spread of diseases. Ultimately, these issues are a result of poor management, lack of their compassion care, and whom seem to prioritize their paycheck over animal welfare. Thank you for listening to me.
Thank you. Next speaker. I have called all the speaker cards. Okay, back to council. I don't see anybody coming back.
Okay, thank you, Tony. I want to thank all of you who came out to this afternoon's meeting, and shared your perspective with us. It's difficult to hear, but it's important that we hear directly from you. It's part of the value of these public meetings is to hear the direct, difficult feedback and examples. And hearing those last year, as I mentioned, is what prompted this audit. And we clearly have a lot of work to do. We're going to talk about that. We're going to continue that conversation here on the dais with my colleagues. Again, I want to thank our city auditor, Joe Royce, and the team for doing a very detailed audit. I have a number of questions and comments, but I do want to I spoke a lot on the last item. I want to turn to colleagues, and then any that don't get addressed, I'll be sure to get to. But I'll start with Councilor Ortiz, who signed on to the group memo that we put forward, which I hope he and others will outline some of our recommendations and the rationale for them. Councilmember Ortiz, go ahead.
Great. Thank you, Mayor, and thank you for partnering on that memo. I just want to start out by expressing my gratitude to the City Auditor's Office and the audit staff for their diligent work on this very important report on our animal shelter. I also want to thank the many active community members, especially our youth and animal lovers who've shown up today to have your voice heard. Just know that I hear you and the council hears you, and it also hurts us to see our animals heard, especially me as a proud cat owner and cat guy. I also want to thank our staff who work at the shelter, and I think this report highlights the amount of pressure our shelter staff are under, but it also brings to light the significant challenges that they're facing. It's evident that our shelter staff are working tirelessly, often under tough and unforgiving conditions. They're doing the best to provide care and services for the animals and our community, despite constantly operating over capacity. And I want to acknowledge the immense pressure that they are, of course, under. However, as the audit points out, we have significant work ahead of us. The findings reveal that despite our team's unwavering dedication and hard work, the limitations in our shelter's resources, outdated protocols, and capacity constraints are severely hindering our ability to deliver the high standard of care and operational efficiency that both our animals and our greater community rightfully deserve. With that being said, I do have some questions, some you may be familiar with, that were asked during our NSE meeting, but I believe these answers are important to reiterate and put on the record for our entire community, especially those who weren't available to attend that meeting. On page 64 of the report, it states that the city engaged with rescue groups through a shelter working group in 2023. However, the meetings were discontinued sometime in 2024. I wanted to ask if someone could speak to why those meetings were discontinued and how will the new Community Action Committee that will form ensure that rescue partners and all partners feel heard given the rescue survey results.
So thank you, Councilmember. Again, Matt Lesh, Director of Public Works. So the working group that was founded before had all sorts of groups and, sorry, you need me to lean the microphone. All sorts of different advocacy groups of different flavors, dogs, cats, trappers, fosters, and rescues. And they have a lot of different needs, but they are the same animals. And so that's, people think all the advocates for particular groups want particular things and particular attention. And so what we decided to do was to break them into, I use the word affinity groups for lack of a better way to describe it, so that folks could meet with staff about particular areas of their particular concern so we can make improvements to their group. And though that's not perfect, it was a way to get so that every voice was heard at different points in time. Now, the Community Action Committee is not necessarily to replace that, it's to focus on 4 specific things. And I also want to tangentially say, here's the chance to form a group of people that we can work together to achieve a certain thing. And if we can build that, so yes, to get to the particular recommendation that came out of the audit, but also to form community around that. And if we can do that about those things, what more can we do? And so it's not going to be necessarily broad-based, but it's meant to be focused on those 4 things. And then if we can be successful there, we'll do some more. And so that was to have it time-boxed, have it focused on particular areas so we all have areas to achieve, and that we could also build community at the same time. So perhaps if there are fractured relationships or feelings, we could resolve those through action towards a particular end.
Okay. Thank you. Now, in regards to rescue groups, on the same page, page 64, the audit states that in an auditor-conducted survey, only 40% of rescue groups rated their relationship with ACS positively. How will ACS rebuild trust with these groups and ensure they have the support and information they need to continue to assist rescuing animals?
Well, as I noted in my presentation, our rescue participation by number of participants actually increased last year over the year prior. Now, we haven't announced this yet, but we're doing our annual report next month. And so we actually increased 7% by the participation of actual rescues. We want to continue that, but we also need to go deeper so we can see what more capacity do each of those have so we can get beyond. And so we are working on specific things that we can do we're working on a draft portal so that rescues can log in and get information curated for them that they would like. And so we have it in pre-alpha version so we can test it out. And so we'd like to get that in front of them to see, does that work? Does that answer most of the questions? Like I said, if we had to get 104 different specific communication channels to be effective, that gets really challenging. Can we get to most of them? And so could this portal be a way to get the information that they need quickly at their fingertips? So those types of things, and then continued meeting with them on at least a quarterly basis broadly to get specific needs and specific action items beyond the recommendations we have here.
And so from meetings with, just follow-up question to that, from your meetings with rescue partners or staff's meetings with rescue partners, you would say this inability to access information is the main concern of distrust?
Right, and that came out of the findings of the audit, that specifically they don't believe they have the information to take action to rescue a particular animal, or it's a challenge to get to it, or a challenge to get to staff about it. So we need to create a communication channel and an information channel that's different than it was before, because it's not effective right now.
Okay, thank you. And this is something I heard, I've mentioned this to you in our one-on-ones. Some community members have expressed concerns that the audit findings are being used to justify a shift from prioritizing rescue partnerships to more focusing on prioritizing adoptions. Could you speak to any of that?
Yes, and hopefully I can say it well this time, because I think every time I say it, I seem to inarticulately say it carefully. Okay. So we want all participation. We want adopters to not look elsewhere if they want an animal in our community, to come to us to adopt their animal. We want rescues to participate with us as well and rescue animals and then adopt them out from their ends as well, whether it's rehabilitating or participating. We want it with rescues, with adoption, with foster, and I've inarticulately said it in the past, and I unequivocally want to be clear that we want to participate with all interested parties of pulling animals from our shelter.
Okay, thank you. One more question, and then I want to go into details about the memo, but the protocols for, I'm sorry if I mispronounced this, panleukopenia outbreak were published in June 2023, but according to the report, on page 24 of the audit, the quarantine of the infected cats didn't start until June of 2024. My understanding, a total year difference. And I'm also informed that 493 cats died during this time. Is there a reason why there was a gap in the protocols being sent out and then actual action being taken?
Okay, so I'm going to have Kiska talk a little bit more details because everybody notes in all their communication to me I'm just an engineer.
Okay, it's a little hard to hear you, sorry.
As most people, I'm a little bit limited as I'm an engineer, so I'll have Kiska talk to some of the specifics about it. But in terms of the numbers of animals that have died and the times and places and slicing of calendar years and fiscal years since the beginning of the calendar year, it gets very challenging in these numbers of descriptors, whether you're talking about just cats or just dogs or all animals. And so we track and report on all of our animals, whether they live or die and how they survive and what their live outcome is. We're not hiding the numbers. As Joe noted, we were one of the most transparent shelters that they've viewed in terms of their research. We have more information and more dashboards than most places do. We have active data feeds of all of our animal intake and outcomes. And if I'm inarticulately saying it, it's not my intention. We have a lot of data out. I've asked for people, with all the people that are asking for stuff, that we can put out as much information. I'll put it out in whatever platform I can so that I can make it so they have accessibility to the information about our animals. I believe the 493, okay, when we're talking about cats that have died, let's focus there. When looking at last fiscal year in terms of animals that have died, the majority of our cats that have died have been little and come into us sick or injured. The majority of them. when I was looking at the dashboard, I was able to suss out of the 490 some, whether it's 486, that range of numbers, 13 were over 4 months old and healthy on intake. And of those that died, most of them had died while they were being neutered in surgery and they weren't able to survive their anesthesia. Now, I don't want to slice and dice data. It's hard to get, there's all these anecdotes and different information. It's the majority of those animals that have died have been the young and the sick and injured by default. And we could slice and dice whether I'm right on the percentage or off on the percentage or numbers, but that's the focus. I'd ask Kiska to talk to the panleukopenia policy, and then Joe wants to talk to you.
Actually, could I jump in because I want to clarify what we have in the report around the panleukopenia and the isolation.
Okay.
So prior to June, what we were noting was that rooms where there was a cat with panleukopenia had been quarantined, so they were quarantining the room.
Okay.
In June, the protocol changed to separate the animals, to have certain isolation rooms. So it wasn't as if the sick cats were exposed to the whole shelter. So there was a change in protocols from quarantining rooms to separate isolation rooms. I just want to clarify that it was
okay. So that wasn't the case.
So there were protocols in place, but they made stricter protocols in June of this past year. That's what
okay.
we were.
Thank
That's
you.
what we
Remember
were
the
reporting.
community wanted me to ask that, so appreciate that. Just really quickly about the recommendations that are included in the memo. They include further critical additional direction towards improving outcomes for our animals, supporting shelter staff, and fostering stronger community partners. Through expanding TNR services to 5 days a week and restoring low-cost spay and neuter services to address one of the root causes of overpopulation, with a focus on prioritizing services for lower-income zip codes, eliminates the $50 rescue partner registration fee, which underscores the importance of our effort in repairing our relationship and leveraging all available resources to ease the burden on the shelter, and emphasizing accountability, requiring updates to NSC by May 2025. These updates will ensure transparency and consistent progress on implementing audit recommendations, including creating work plans and timelines for outstanding items. I just want to thank you. I want to thank the colleagues in the memo, and I want to thank you, Matt, and everyone in the box. And please, Matt, if you have something else to add, please do. Thank you.
I just wanted to clarify one thing on, this is recommendation number 6, is to remove a fee. Apparently, I got the city attorney's office clarified something for me. Apparently we have, the municipal code requires, as of right now, a fee, that a fee be charged for administrative costs for a register. Now, that fee could be $0, so my request would be, and look to the city manager for guidance on this, is that instead of remove a fee, is that maybe the fee be 0, and she could give us guidance as to the best way to deal with it.
Yeah, I think we need to set it to 0.
Okay, sounds good. And I motion our memo from the mayor, vice mayor, myself, and Councilmember Dewan.
Right, thank you, Councilmember, and thanks for that clarification on the fee. Let me turn to Councilmember Dewan.
First of all, I would just like to say thank you to staff for the report, and thank you, Joe, for his audit. And thank you, all of you out there have come to this meeting and addressed a lot of these concerns. Now, I've gone out there to the animal ACS in a formal setting and gone out there just T-shirts and jean and a hat on, without notifying our staff. And yes, I hear all of you that can we improve? Absolutely. We can always improve on what we're doing now. But you have to look at the realistic condition between 500 to 700 animals at continuous basis that coming in and overcrowding. And that's why this audit is extremely important, that we have 39 recommendations. And I have spoke to Joe and I have spoke to Matt, and with his thoughtful collaboration in order to address a lot of this stuff. And it'll take a little bit of time. And I think that we as a whole need to collaborate. I mean, I can go in there and point out all the bad stuff. Or I can go in there and say, okay, these are stuff that we can improve, but these are the good things that we have done. And I think that if we look at the collaboration, not only for all the nonprofit organization, all the animal rescue, including finding, funding for the TNR, I think we can come to see a clear conclusion that we can reduce the amount of animals in the shelter by creating a more robust program for adoption. And I know people don't realize how much it costs to adopt an animal, right? Not you may go on the holidays, you may get a $20 adoption fee, but then it comes with a lot of additional cost, which people don't realize. And I happened to adopt my German Shepherd. Her name is Maggie, and found her out on Capitol Expressway in McLaughlin. And I really do understand. It took me 12 weeks to address her, separation anxiety, diarrhea, and it took me about 8 weeks to address the separation anxiety, including 2 weeks that I slept in the cage with her every night in order to overcome that. I understand all the problems that we have out there, but people, please, work with our staff, work with our city. It's about us working together to make it better. And I do have a question for Matt. Obviously I work in the fire department and many other entities out in the private world as well. For example, a company called Fastener, when they have a product, it comes in, you have a barcode. You know exactly when it's coming in, when it's going out, who's it going to, does it have any problem, and when that problem being fixed or recall. And so animal comes in, we'll put on a collar with a barcode, couldn't we track, when the animal come in, what type of history, what kind of medication, when it was being treated, when is it moving from one area to another. So that way we can have a very clear, open communication, transparency, so all of our residents out here who care about the animal can kind of keep track, and so is our staff.
Is it possible? I could say our facility is not presently set up to accommodate that. Is it technologically possible? We can evaluate that. Not every animal is well suited to getting collars put on them easily. Sometimes they're hard to handle. So how do we, could we do everything perfectly on every single case? The answer is no. But is there ways to improve the location of an animal? We'll evaluate what type of technology is out there to see if there's something better than what we have now.
Thank you for that answer. And I think we somewhere we missed a big step. And I think that, create a program that is help our underserved community and our unsheltered residents on the spay and neuter. That's the root cause, right? Because a lot of those animals are multiplying out there, and then now it comes to the shelter, now we have to deal with it. So if we can look at the program, hopefully we can, in the mayor budget as well, to find funding to make sure the animal out there are being spayed and neutered. And I know it's extremely difficult for us to make everybody happy. But we need to come together and collaborate. We can't fix this by ourselves. We're going to collaborate with all the nonprofit and the rescue and other jurisdiction. Do we have a data to see how many animals are coming from Cupertino or Milpitas or Saratoga? If so, then we can break down the amount of cost, so maybe they could chip in even more funding, so that way we can take care of the animal within the shelters.
We do evaluate the number of animals coming from various jurisdictions that we are contracted with. The last 3 contract renewals that we just two contracts we renewed, and then Milpitas was done separately. We did evaluate where they're coming from and make sure that all of the different capital improvements or other investments that we've made in additional staffing, that they were captured in terms of percentage attributed to the animals that are coming from that jurisdiction.
Thank you. Well, I'm just going to leave this last note here. Just be assured out there that every single council member, including our mayor, are committed to make sure our animal shelter continue in its progress, and the animal will be treated with, kind, caring, and compassion. Yes, there will be mistakes. Yes, there will be problems in every single household, in every part of society, and we need to be patient. And I hope that all of you out there bring that energy, come together with us, with our department, and help us find a solution and make it better. Thank you so much.
Thank you, Councilmember. Let's go to Councilmember Batra next.
Thank you very much for that comprehensive report on the audit and the comments from the public. I got a couple of questions before I offer my comments about what I notice here. Have we ever drawn any expertise from outside to evaluate or restructure our animal shelter with the times as things have changed? The pandemic has created a whole set of new conditions for the animal shelter. To bring it up in line with what it needs to be, meeting the current needs?
Yes.
We have.
Yes.
And what kind of consulting or expertise we have brought in from outside?
So a couple things in terms of, just to be clear, are you referring to the shelter itself, the physical building, or are you talking about the operations overall?
Overall management, whatever the shelter process.
If I could join, so the seventh finding related to tracking recommendations from an outside organization, Maddie's Fund, who did a consult report, or did a consult back in 2022, had about 200 different recommendations across different operational aspects of the for the shelter. And the recommendation we have there is to look at those remaining recommendations, prioritize those, have put somebody in charge of who's accountable of tracking and seeing the progress. Some of those recommendations may not be still relevant. They came out prior to the most recent Association of Shelter Veterinarian Guidelines. So that's one piece. Another thing that's happening right now is there's a condition assessment of the shelter itself, which will likely have some recommendations on the capital side of things. So there's a couple of things that are happening that hopefully address what you're getting at.
See, your list of recommendations, 39 of them, is quite impressive. But from what I look at it that's almost like the auditors running the shelter. And it's like a micromanagement to me, okay? Those things, when you're writing in there that we should collect this kind of data, that does not sound like it should be coming from the auditor. From my perspective, I would expect that to be coming from the management of that unit, okay? But 4 or 5 recommendations of some kind would have been okay from, having to give this level of detail. I think it's really, basically you're running the shelter. And the mayor having to write that remove this $50 fee, again, is a level of micromanagement which we as a council or you as an auditor should not be doing this. I think we need to fundamentally look at it as the shelter probably needs some major changes because the times have changed, the needs have changed, the kind of people you're getting in there or kind of animals you're getting, how many you're getting, all of those have changed. And as a result, it should be the management team over there. We need to make sure that we have the right management team who have the expertise. And they're the ones who should be making these recommendations that we need to fix these things in order to keep the shelter meeting the needs of 2025 and 2025 and beyond. It's impressive that you were able to get in and made all those recommendations, but from my perspective, that is not what an auditor should be required to do for any particular department. Okay? So I would suggest, Matt, that I think you need to look at it if you really need some consultant from outside to be able to come and evaluate and work with you for some length of time to structure your team in a way which will allow it to be done the right kind of services which will be needed. And as a result of that one, you would be probably better off. But in the meantime, if you want to go ahead and make these 39 recommendations and make some level of improvements, those are great. But I think you need to look at it overall how you're going to make the direction to be, which is going to meet the needs. And the next time when we have a audit or any of these things, we wouldn't get the kind of comments we are getting today. So that would be my suggestion to you.
If I may, council member, and I don't mean to be argumentative, our staff has spent the last 12 months working with the auditor's office. Many of their ideas for recommendations were generated from their time with staff. Not out of whole cloth out of their evaluation, but their time with them and how we could implement the ASV guidelines, how we could be reviewing what we think about different aspects of the shelter. So to say that we are doing this as a result of their review of us and that they're micromanaging us, I do take measure with that, and I just wholeheartedly disagree.
That's fine. I didn't expect that you would agree or not. The point is, I spent all my years in managing these kind of departments. If I had a 39 recommendations at that kind of level which I'm seeing, I would consider it to be micromanagement, because you look at recommendation number, this is the kind of data we should collect and we should disaggregate at this level. Those are definitely a micro level management from my side. But it's okay, as long as you're going to be, you believe that these recommendations have arisen as a result of your staff's expertise and they're all going to be good to implement and make things better, I'm fine with that. Okay.
Yeah, my request to Joe when he was developing the recommendations is that they be digestible and achievable in a very short period of time. And he did that. I think all of his recommendations are achievable by our staff and achievable by our management team. And that's the reason why I'm grateful for the way he structured his recommendations. Partly, I mean, he didn't do it at my behest, but my request is make these things achievable quickly, because I don't think that the community would welcome a long-term thing like happens with many other audits that are very challenging. This one are digestible and easily bite-sized chews that we can achieve on it. And I apologize if I'm coming off as curt.
If I could jump in. So there were a lot of recommendations, yes, but a lot of it just reflects the scope of work that we were asked to do. And so we were asked to look at quite a bit of different elements within the shelter operations. And the one you had mentioned about kind of the detail of the what measures we should be using, I just want to quote to you from the original direction to our staff was a comparison of ACS operations against industry standards for key shelter metrics such as length of stay, live release and euthanasia rates, condition of animal intakes, and on and on and on. So our recommendations and our findings are very much driven to be responsive to the questions that came to us from council direction, as well as concerns that came to us from the community as well. So it may seem like micromanagement, but we were trying to be very responsive to the questions that we were getting from council members, from the community, from volunteers and rescue groups, and I think that's pretty much why there's so many.
As I said, as it improves the service, I'm fine with it, but this is what the appearance of this thing is, and those are the comments I made to you about that one, okay? So this level of detail you were asked to provide, you provided, but the appearance of that one to me is not very good, and I wish there was a better way to communicate that information. Okay? All right?
Thank you. Thank you, Councilmember. All right, let's go to Councilmember Cohen.
Thank you. First, let me start, Joe, by thanking you and your team for such a great audit. The council asked for this and asked for you to dive into great detail, which you have done. And really, it was one of the few that couldn't stick in the binder because it was so wide. But that means there was a lot to look at, and you did a great job of digging in and giving us information that's very actionable. I want to thank my colleagues for digging into the detail and putting forward the memo. I have some comments, then I'll ask a question about that action plan at the end. Obviously, the problems at this, we've been hearing about these problems for several years. I've been on council 4 years, and this has been talked about once a year, every year, and it gets frustrating, obviously, for those of us here to be hearing some of the same concerns over and over again. Clearly, the problem and need is growing faster than we've been able to keep up. I don't think there's much, I hope there's not much debate about that. But I also want to acknowledge people are working under very difficult conditions in the animal care center and are, dedicated to their work and trying to do what's right. I will also just say I don't think it's helpful for us as a city to be defensive about it either. It's probably better for us to say, hey, look, we have a problem. We want to fix it. I think all of us would love it if next year we're not having the same conversation again, because we've been having this conversation year after year, and we know there's things to address. We want this service to be functioning well. I have some questions about some of the things. I think I've asked these questions in the past of folks at the Animal Care Center, but now that the auditor's looked at it, maybe you can answer this a little bit. I've been concerned about how we offer this service to neighboring cities. And I was struck in the audit by something that said that neighboring cities often appear to be getting better service than we can provide to our own because we have contractual obligations to do so. And obviously our goal should be to make sure that our residents in our city are getting the top level service that everyone else, the other contractors with us, are expecting.
So as I understand, when the contracts were initiated with the jurisdictions, we shared with them what our level of response was. Primarily, you're talking about field response as opposed to medical response or response at the shelter. And they asked for a higher level of service than we had in terms of what San Jose was, and so we charged them commensurately. We charged them for the enhanced service. So it's not like we decreased San Jose's service. The service that we had for San Jose was what was before, and then they wanted enhanced service, so they paid for additional animal service officers, they paid for additional vehicles so that we could provide these additional services, and then their contract is higher. Their contract cost should be higher than it would be as if we did that here. If we provided the same level of service in San Jose, we would need more staff and more services to provide that. It's not to diminish San Jose, it's just that's what was asked for by the contract cities.
Okay, so Joe, the audit, at least my reading of it, seemed to imply that we weren't necessarily recovering our costs in some of these outside contracts. Is that, do we believe that we're at least recovering the costs for providing service to other cities?
That's a great question. So the answer is we don't know yet. And so looking at it through well, let's take a step back. So the contracts and the cost elements and the number of field events, what have you, were based on prior year's activity. It was just 1 year of activity, so hopefully that was representative. Our recommendations really are more forward-looking to looking at to what Matt just described. Should we be looking at aligning our service delivery for priority 2 and 3 calls? So these are like the animal bite reports, investigations, what have you, with neighboring jurisdictions, so we're having that level of service. And we should be tracking costs and activity moving forward on a proactive basis, so we know whether we're getting that cost recovery. The contracts just came into place. The most recent contracts just came in place in July of this year for 2 of the jurisdictions, and I think October or November of last year for Milpitas. And so we didn't have a really robust set of data to see what is happening on the ground with the current agreements. Like I said, we had like a month of data.
I'm sorry to interrupt, but I always am conscious of my time, so I try to move
sorry.
it along, but it's okay. It seems to me from my reading that at least in Milpitas, we're not recovering costs, but I think we ought to be at least looking into it and come back with some more information about that as we move forward, and maybe we don't have all the answers today. My basic question has always been, is this something we should be in service of doing? We have a service that we need to provide to our residents, and we're not providing it up to par, and yet other cities are contracting with us to provide service to them, even though there's also county and, for example, Humane Society and Milpitas and other agencies that can provide services in other jurisdictions. So I would even ask the question that we should look at as to whether we should even be doing this. Would we be able to better manage our program in the city of San Jose if we weren't also responsible for managing it and overseeing the service we're providing to other cities? And given the problems we've been having with this service, should we consider how we can wind that down? And I guess I don't know for sure how long these contracts are in place, when they expire, but I would love to evaluate that question and not necessarily be responsible for the cities around us, be responsible for providing the service that we need for the million people of the city of San Jose. I don't know if I see you're nodding your head over there, Angel.
I would say the number of animals we get from the other jurisdictions are pretty de minimis compared to what we get in San Jose, like dramatically so. And we'll have last year's numbers in our annual report next week. And so when we publish it at NSC, I apologize for not having those in my head today.
Okay, so we can do an analysis as to whether
for sure,
we're covering our
and we certainly
costs or
have
not.
the numbers of animals that come in from those jurisdictions, and it is far less than comes in from San Jose.
Okay.
Based on an early analysis, we had about just over 5% of the overall animal intake in 23-24, which I don't know what's going to be reported at NSC because we had cutoff data.
Do we also handle licensing for Milpitas?
Yes.
Yes, and my understanding was we don't require the same vaccination levels from Milpitas. They don't require the same. They don't have the same requirements. Is that true as we do in San Jose, and we administer different requirements?
I don't believe so. I believe we administer the same requirements.
The same requirements in Milpitas. Okay.
So
Thank
Council Member, I think those are fair questions. I do think they deserve additional analysis. I've asked staff too about our cost recovery levels, and I think as we start working on these other recommendations, which might be a little bit more urgent, given that there is not a lot of animals coming in, I think anything we can do to make sure that we're using every one of our resources as efficiently, effectively towards San Jose animals is important to look at. So I think we will definitely put that on our work plan. It may take a little bit of time as we put some of the other things more urgent ahead of it, but it's a fair question.
Yeah. Okay. Thank you so much.
And Councilmember, just on that, sorry to interject during your time, but I wonder if we might just add that as a friendly amendment to be part of the report coming back in May. That
would be great.
Be something, and would that work for staff?
What specifically are we coming back with in May? Just make sure.
I'll let the council member articulate what he's looking for.
I think I was asking questions about the cost recovery of our neighboring cities and how that impacts, and whether or not providing those services is impacting our ability to provide the service that we need to do for our city. So I don't know if there's a...
I believe we can come back with that information in May. I think that's probably fair. Like, what are we getting from those other jurisdictions in terms of money? And I think is it cost recovery for the stuff that we provide to those other jurisdictions? I think we can come up with that information. We have to do that analysis anyways for the budget timing to see how we're doing, and I think that's probably fair.
Okay.
We can do it in an oral update in May.
Yeah, I appreciate that.
Does that work for the maker of the motion?
Yes, it does.
Okay, and the seconder?
Great.
Okay.
Whoever seconded it. Okay, there's always 2 seconds to every motion.
2 seconders, apparently. Yeah.
So, the last question I'm going to ask is kind of to be a little provocative and push back a little bit on the timing in the actual primary memo that's being moved here. I mean, I know there's a request to come back in the budget cycle to evaluate whether we need additional service. And while rather than be defensive about, well, we can do it, the question I have is, can we be better served and helped by having some additional help to do it? So it's not even a question of, hey, not about agreeing with the recommendations or whether we think we can do the recommendations, but hey, could we have some managerial or content expertise that could come in and help improve and expedite the improvements that we're asking for, or that need to be implemented from the audit. And while I understand that there's potential budgetary implications of that, it seems to me that there's also been some talk about, there's been unfilled positions and some savings in there, so there could be budget within the animal shelter right now that could be purposed for a short-term external contract to help make sure that we implement these things over the short term. And I'm curious, what the feeling is about, the need for the help. Without trying to say anything about the people who are there, there's always could be benefit by having some extra hands on deck to implement what is a hefty set of recommendations.
Councilmember, let me address that. Angel Rios, Deputy City Manager. I think those are wise words. This is a lot of work, and we do need help. And so I think that's definitely an option that we will basically take back and really strongly consider. I know Matt and I have had some conversations around what that help could potentially look like, and we have some ideas that we've thrown around. So we will definitely take that into strong consideration, because I do think it merits the additional
So can that
assistance.
be maybe part of the motion's first item, is to consider moving forward some of that if we can do it within current budget?
I'm pretty sure we can't do anything within the current budget. I'm just going to be really direct. I think this is a mountain of work that needs to be achieved. I agree. And the amount of time to try to even find out and do more discovery of more things only adds to that challenge. And that's one of the reasons why when I'm talking about all these additional recommendations, we have a very low vacancy rate in our animal care and services. We have below the city's average vacancy rate, and we prioritize the recruitment of that staff above the rest of the Public Works Department, of which I'm going to talk about the volume of some of the work in the subsequent items this meeting. So it will definitively need additional resources to do just that. And if you want us to do that, that's a direction, but I'm not going to dance around it. We will need more resources.
Yeah, I agree with that, because I've asked them to prioritize those fillings of vacancies, and you graciously gave us more budget in the annual report so we could advance some of the work ahead of time. So what I can commit to is that we will, this current year is already proving to be a very difficult budget year, and we'll be talking about that more on another day. But I am very concerned about our current fiscal year's budget. But I will commit to you that we will do as what Deputy City Manager Rios has indicated. We will brainstorm. I'll see if we can move any resources around, but I'm not sure it will be able to come from Public Works. If it comes from someplace else, we'll see if we can do anything to advance this, because this is a very important issue. It's a very important policy issue. And we all want the shelter to be performing better, and that's why we've been investing in it, and that's why we've been filling the vacancies. So we'll see what we can do. I just can't make any guarantees right now, given our current state of the budget situation, which I'm a little bit more flexible with it, but I'm very concerned right now.
I fully understand. We're all concerned, and I want to say I appreciate that last year we did add money to the budget to fill some gaps that we really felt were there, and I think we're committed to that. And I really appreciate the city manager and folks at the leadership there to identify areas that we were able to improve in our budget last year. I want to make clear to everybody, we are investing in this service. In my mind, the sooner we can, ramp something up and get fixed, the more cost effective we will be as a service provider, and it'll be better for everybody.
I think we share that thought process, and I appreciate the council's support of the additional investments even during our difficult budget times. And again, even off cycle, as soon as just as recent as the mid-October annual report, you approved even additional resources that will be going into our base budget. So as soon as if we see new needs, we are not going to be shy about bringing these forwards, because these are living animals that need us to speak for them, and we need to bring that forward to you. It's not, if we had to be a little bit later on mowing the grass or letting the weeds get a little higher, I'd much rather make that trade-off and give that to the animals, and that would be my recommendation. So if you give us a little bit of space, we'll take this back, and again, to look at any ways we can potentially move some budget around to accelerate the biggest bang for the buck as we move forward and work on these recommendations.
Thank you. I appreciate it. And I know that everybody does want, I think what everybody's hearing is we all want to figure out the best way to fix these problems. And as some people know, my daughter's training to be a veterinarian, and I've been trying to say, when you come home for the summer, you should work there. She's a trained vet tech now, and I would love to be able to recommend that this is a great place for her to be when she, finishes her training. But we need to do some more before I'm able to fully recommend that. So I want to make sure that we're making this the best service possible and that this is going to be a desirable place for people who care about animals to be and work. So thank you very much.
Well said. Thank you, Councilmember. Vice Mayor?
Thank you so much for the report. I also want to thank all of the speakers who came because I know that you really care. Our council members who joined in the memo, I'd like to thank you as well. I know that this is a huge challenge. We've been here before. And I think that we might see it as an opportunity to kind of step back a little bit and think about it in terms of not just the 39 things that are on the table that need to be done in the next time frame, but thinking about the capacity of the facility and what can and cannot be done. And I know that there are always trade-offs, and everyone wants to say yes, but sometimes you have to choose between providing the services, let's say, to other cities or whatever. And I think that capacity for me is something that we have to face because it wasn't meant for as many animals as is there now. I also think that the cost of veterinary services in the community, as well as animal care of any sort, has skyrocketed, right? I personally don't have I don't have a dog, but I have what I call a grand dog. Both my kids have dogs. I love them. And I try to be with them as much as possible. But I also know that when something happens, it's very expensive, right? So I think that, the cost is just over time has escalated so much that we need to think about this and what are the trade-offs from a budget point of view. I also think that, as my colleague, Councilmember Duan, mentioned in terms of collaboration, I think that there are a lot of people out there who want to help. And if we can address how we can manage the capacity part, that might be something to think about. So those three things are the things that sort of come to mind. And I know that you have to focus on these 39, but over the long run, I think that capacity, cost, and collaboration is something that I'm going to look at in the future. So thank you.
Thank you, Vice Mayor. I want to thank my colleagues for all their thoughtful questions and comments. I have a few myself. Joe, when we sat down and went through the audit together a few weeks ago, I believe you told me this audit resulted in more recommendations than you've ever produced before for an audit report. And I think it's a testament both to your team's diligence, but also emblematic of the significant work that is ahead of us here. And as has been made clear repeatedly by members of the public, this audit laid bare significant challenges our animal shelter faces, challenges we need to quickly address for the sake of the many vulnerable animals in our care. I'm especially concerned that staff yellow-lit nearly half of the recommendations in anticipation of potential budget constraints, which are a real issue, as you just heard from our city manager. Of course, if we do not identify the resources to implement those yellow-lit recommendations, we'd be probably minimum 18 months out from implementation, which is the ones that were yellow-lit, which to me is not acceptable. So if we truly need more resources to implement those recommendations, we need to know that very soon for this upcoming budget cycle, not many months from now. We need to start planning for that at this point. Matt and Angel and everybody on the team here, I hope you'll also take a closer look at which of the recommendations truly need additional resources for implementation. And truthfully, I'm skeptical that much of this work can't be absorbed by the existing and recently expanded staff. Things like modernizing policies and procedures, communicating protocol changes, providing sufficient staff training, improving our record-keeping practices. These are the kinds of things I would expect the current leadership, especially given, and I was looking at the chart, if I'm not misreading it, We have now in the last 2 years increased funding pretty substantially. It looks like about a 50% increase at the center according to the chart, which is a very substantial increase. And I have to say, my working hypothesis coming in as mayor 2 years ago was that the primary issue was a resource gap, and certainly we were under-resourced. Whether we continue to be under-resourced, I think the Vice Mayor makes a good point about the physical space. That's clearly an area that we need to invest in. We simply do not have the physical space, given that animals, especially given that animals are staying longer, and in many cases coming in sicker. But this audit does call into question for me what else we need to get right beyond just resources. I think there's more than resources here. And above all, the audit underscored for me that it is long past time we get serious about restoring TNR services. Until we do, we're just failing to get upstream of a growing problem, and it's like trying to, use a cup to make a dent in a lake. It's just we're never going to catch up here. We're turning animals away at the shelter's doors and leaving community members to fend for themselves when they've found a stray cat or dog. We have to get upstream, particularly at a time when in the private marketplace veterinary care has become increasingly expensive. And so we're the center of last resort and the place that people need to be able to turn to for low-cost spay and neuter services, and we have to start reducing long-term demand through significantly expanded TNR. I want to thank Mackenzie Mossing, my chief policy officer, who spent a lot of time with many of the advocates in the room and did a lot of the legwork and the research and writing that helped go into our group memo. And again, I want to thank my colleagues for their work. Our memo seeks to hold us all accountable for the commitment we made with our current budget to restore TNR services to 5 days a week, given the additional veterinary staff council approved in June and then again additional funding in September. So Matt and Angel, I hope you will accept that challenge that the council's laid out, and I believe we all believed we were funding in this year's budget. Our memo, as was mentioned, provides a checkpoint on progress as recommended by NSC Committee Chair, Councilmember Dev Davis, and after consulting with staff, we've landed on May as an opportunity, a good milestone, an opportunity to check in on progress with a more substantive update. I want to hear, especially at that time, on our work toward restoring TNR services to 5 days a week, and critically important, a work plan for providing low-cost spay and neuter services for owned pets, as well as a work plan for implementing any outstanding recommendations that have not been completed at that time. At that point, I think it's important that we are all very clear about resource gaps where it's truly needed, with a reminder that we need to be able to do more of this with the capacity we have today that we have already funded with a substantially increased budget. And when I say a work plan, I think we need something akin to a Gantt chart that shows us actual implementation milestones over dates so that we know when these will be completed. Finally, given the significant decrease in animals diverted to rescue groups and the obvious need to divert more animals out of our shelter, the memo asked staff to sit down with rescue groups and ask them to commit. First, listen and get more of their feedback, but also ask them to commit to pulling a certain number of animals at an agreed-upon cost for veterinary care as needed, and really reestablish and expand that collaborative partnership. I think the bottom line, and I do have a couple of very specific questions that I'll wrap up with, but the current performance at the shelter is obviously unacceptable. It's not where we need it to be. We have to do better. The council has responded over the last 2 years by increasing the budget at the center substantially and calling for the audit that we just received today. It is time for results, and we need to see them, and we need to know, if you're not in a position to deliver them, what else you need from the council. But we are expecting the administration to deliver on the recommendations in the audit and demonstrate improved outcomes for animals in our care. My specific questions. First for Joe, we'll be seeing this update in NSE in May, but can you remind us when you return to council with updates on outstanding audit recommendations? That's an annual report you give to the council.
It's a semi-annual report, so we'll be coming back in March and then again in September.
Okay, so everybody mark your calendar. March and September, we'll also have a check-in on any outstanding audit recommendations, including the 39 here. Matt, I noticed in the public comment record that there are some veterinarians who have offered to come on board on a contractual basis to help with high-volume spay and neuter. Are we taking those offers seriously, given our limited success hiring part-time vets, and how can we get more creative around contracting out some of these services?
That's a complicated question there, the way you worded it. So we've not been having complications finding part-time vets. We have complications finding full-time permanent vets.
Okay.
And so that's what, to nuance. And what I advise to some who have asked me, the fastest way to get them on, if they want to help our animals today, is apply to the job that's open as a part-time vet, and they can come on, we can hire them to do just that. The challenge is when it comes to both spay and neuter, if that's the specific thing that they will only do, is we then need to supply the vet techs and everything else in the space. And so it's not just a one thing of bringing on the vet. So the contract, and then there's complications in terms of insurance if we bring them on as a contract employee. And so they need to carry all the liability insurance and everything else, and we need to put that out to an RFP, and so it be as competitive to get. So there's a complication there to swing both of those. And so I said the fastest way to help the animals is to come on as a part-time vet. We are going to be working with purchasing financing, putting out spay-neuter services, but to contract with an RFP, and they can apply there as well as some of the other contractors that we have currently.
So if there are vets who are qualified and willing to come on board on a contractual basis to focus on that much-needed service, is that something we are looking at, trying to accommodate?
Yes, the RFP that we will be putting out in the spring will address that. If they want to come on immediately to help us, the fastest way to do that is we have an open application that we have out there for part-time and full-time vet.
Apply for part-time or full-time.
Exactly. We can get them on quickly doing that.
Okay. I'm glad to hear we're offering multiple avenues. I think that's important. On spay and neuter, as you just mentioned, we've added a number of positions for both full-time and part-time veterinarians. I guess I'd like to better understand where we are with TNR. I know in the March message that we adopted, we called for the restoration to 5 days a week. As I understand it, we're not there, and I guess I'd like to better understand both how we're going to get there, and then I have a sort of related question about where we are in expanding or providing low-cost spay-neuter services for the broader community as we used to do. So maybe it's easier to separate those out. But.
Okay, so we've been given resources, admittedly, we've got an additional veterinarian and some additional vet techs. To provide spay-neuter services, we need three things. We need the space to do it, the operating room. We need a veterinarian, and we need vet techs to support that veterinarian under the current mode. Mm-hmm. And so all of those things need to come into play. The challenge we have in terms of prioritizing everything is the volume of animals in the building that are sick and injured we need to care for medically now, that are sick and injured that we have in our possession now. I mean, as of today, we have 460 animals in the building. We have another 564 we're responsible for medically. That's 1,000 animals, so 564 in foster. So that's our problems, that we have 1,000 animals in our ownership right now that we need to provide medical services for. To provide additional services outside of medical care, that's where we get that stretch. And so our plan, our approach has been, we've gotten vet techs in terms of some of the budget cycles. One of the reasons why we pulled back from some of the spay-neuter services is when one of our permanent vets went to part-time status. And that's why we've accelerated and tried to recruit for this full-time status. So that way it helps us in terms of our ability to deliver. Anything you'd like to add, Kiska, in terms of our spay-neuter services, in terms of provided for publicly owned cats or private cats?
Thank you. I do agree that we have to cut it off at the tap. We're not going to be able to adopt our way or transfer our way out of this the rising number of animals that we're seeing come to us. And over the last year, there's been a 30% increase in just the number of kittens that are coming to us. So spay, neuter, and particularly TNR has to be one of our laser focus areas. We have hired a full-time veterinarian that I believe or finishing up the recruitment, and we're hoping that that person can start at the beginning of the year. And while our population is down, that our kittens are not coming in the waves that they are, that we can use that time to have our team trained up and begin to service the community. But we're going to have to, again, as Matt says, with the number of animals that we have under our care, that has to be the priority. So as the numbers are coming up, I really think working with the private veterinarians, it used to be that if you acquired an animal, you would take them to your vet and they might charge you, $300-400 to spay and neuter. Now they're charging upwards of $1,000. So that has added to our limited capacity that before the veterinarians used to be able, public veterinarians, private veterinarians used to help with spay and neuter. That number has really diminished because people can't afford it. But you have my commitment that TNR is, and helping with underserved communities. If they can't get their animals spayed and neutered, then they're likely to reproduce, and then we have more mouths out there.
Thanks.
If I could correct one thing that Kiska just did, because she might not have heard the information I got from our HR team, that the veterinarian application for our permanent vet decided to go part-time. And so it was just this afternoon that I heard the information, so she might not have got it.
Okay. Thanks. And in the interest of time, I have a few more questions I want to try to get through quickly. But, Matt, you mentioned there that on TNR and spay and neuter, the limiting factors, or what the three things we need are vets, techs, and space. It sounded to me from what you said that space was actually our biggest constraint and that we're making progress in hiring. What are you doing to solve that? Are we looking at creatively flexing existing public space? Should we have a dedicated center just to serve TNR, just to serve spay and neuter more broadly? I mean, what are we looking at to solve that constraint?
So there's a yes and scenario on that. One of the things, as the kitten season was winding down in August, September, I asked staff to focus on moving as many animals as that we have, neutering as many animals that we have in our possession now so that they're available for adoption. Many of the animals in foster are waiting to be sterilized so that we can then turn over to adoption, and then the animal is no longer ours. And so getting through that glut of the population is one of the focuses I wanted in the wintertime so that we could also do some spay neuter come January. It's just been, we got down to 180 dogs, and then piles of puppies and dogs came in over the last month. So we got up over 200, now we're down to 188 dogs in the shelter today. And so there's this massive fluctuation. This is not a static population. Many times I get weekly updates every Thursday on the population flow. It's 200 in, 200 out, 250 in, 270 out. Massive numbers of animals go through that building every single week. And so it's not just a static population, it's just waiting to go. They're moving all the time. And I think one of the things in the recommendation that came out of the audit is to focus on how do we build that capacity. And that's where I think that Community Action Committee really can lean in. What ideas do you have? Because all of the answers cannot be at the shelter. What things can we leverage in terms of contracts? What things creatively, what can we do? Do we know of any places that we need to have? That's where I want the Community Action Committee to focus on those things. And so if we could initially, in these first few months of that Community Action Committee, focus on those things urgently, because if we can get those things frontlined, that's an importance to us.
Great. Given that the committee will have limited space, if somebody can't participate but wants to give input, what's the best way to do that?
For right now, until we get a unique channel, email it to me or email it to Kiska and we'll get it moving. But all the ideas can come in. We'll get a dedicated place for people to provide additional insight.
Okay, I'm going to try to do this very quickly. Three final questions, but they're all thematically the same. These are on the yellow lit items, and clustered some of them together. It's not about all of them, but it's thematically the same point. Recommendations 8, 22, 23, 24 essentially pertain to better tracking of animals in foster care and coordination and communication with rescue groups. I'm a little concerned it's yellow lit, given that we approved an overstrength foster and rescue coordinator who I assume should be taking on that work. I guess my question is, why is that yellow lit, and isn't that something that the foster and rescue coordinator can take on?
As a person, yes. I'm trying to be mindful of your time. As a person, yes. But if there's a system you needed a tweak, I'm not talking it needs massive dollars, but if it needs an additional $10,000 or $20,000, whatever, if there's a system needed to help manifest that to be faster, we'll evaluate that quickly. And if the answer is no, and what I did is I was evaluating green or yellow, like, could this have any service of a need of a system to invest in to make it efficiently happen? The answer could be yes. If you look at some of the contact systems, we don't have great customer contact systems in the city. It's being evaluated and procured through the city manager. Maybe there's something we'll leverage there. We don't need additional resources. We just need to evaluate what's available in terms of resources writ large. If we have it, we don't need to. But part of it is there's a lot of things I need to respond to, and I needed to do it quickly.
All right. Well, I would hope in a $15 million budget that a CRM for $10,000 a year isn't something that would make this yellow. But when will we know if that set of 4 recommendations are yellow or green? Because I think it matters to all of us which it is.
So through your recommendations, you're requesting us to come back with any resources that are needed for this current budget year cycle. You'll know this budget year cycle if any of these recommendations need additional resources.
Okay. Recommendations 14 through 18 pertain to updating policies, protocols, formalizing operating procedures, communicating those to staff, improved record keeping and data entry protocols, formalizing supervisors' areas of responsibility. These, again, yellow lit, but feel to me like basic responsibilities that the existing management team must be able to assume and implement. Why, again, there would those, is that your understanding, or are you thinking about that differently?
So I don't think we necessarily need more people to do it. Again, it could be a contemplation, are there tools that are needed to make things more efficient and available to make those things happen? If you look at all the nuances of the recommendation, there could be an implication where a tool would provide, especially the communication with staff and everything else. We are not doing this in a vacuum of no animals. We're doing this in a vacuum with a large number of sick and injured animals. And so it's not like we're doing this in a place of calm, we're doing this in a place of crisis with the animals. And so we're trying to get to a place, is there additional resources that would help make that happen? We need to evaluate that quickly. In terms of the time I got the audit, in terms of I could not do that evaluation by the time I needed to provide the administrative response. So I think I owe it to you to tell you that this might need it, but we should evaluate it quickly, and we'll have that by the budget cycle or an MBA to be done with it.
All right, I think it's really important that things like formalizing supervisors' areas of responsibility and being clear about protocols for record keeping, that just, it's clear who owns that, who's responsible for it, and we don't take a long time to make sure we have clarity.
Yeah, so one of the things in dealing with Joe and his audits in the past, I've had systems that I needed to implement, whether it's an electronic system or an actual system of people. He is very detail-oriented in terms of the definition of done. And I actually need to achieve and document it and have it persist beyond just a checkbox. And so there's things that need to go into that of how to make that happen. And so
I appreciate
I've open audit recommendations from 4 years ago because I didn't actually have a system fully on, even though I had it fully beta tested and everything else.
Well,
it'll get done this year.
That's why he's the city auditor.
That's right.
He's a stickler for the details. It's good. That's why we hire him. Okay. Well, then, I'll just say, similarly, I'm not even going to ask the question, but recommendations 11 through 13 have to do with updating the manual to align with the ASV guidelines regarding things like disease detection, isolation, cleaning, vaccinations, et cetera.
But it's not just updating the manual, it's also completing the training and introduction of all the staff and make sure that it's all complete. It's not just creating the manual, it's that plus. And so it's not as easy as, here's the manual, we're done. We'll need to prove to the city auditor that we've completed and successfully trained the staff to those protocols and are consistently performing them. Having been through some of these before, that's not just the case of completing a manual and send it over the goal line. He's going to say yes. It will be more than that, and I believe it. And that's what producing a book doesn't help. Producing a book and training and persistently doing it is the right way to get it done.
I don't disagree. I'll look forward to hearing in the spring as we go through budget that these are greenlit to be done by the end of 2025, or if there is any barrier, blocker, cross-dependency that would prevent that. I think we need to know very clearly what will be completed by the end of 2025. Okay, we spent a lot of time on this one for good reason. Again, I want to thank all the members of the community, all the advocates, volunteers. I'm sorry, I see my colleague has his hand up. Let me go to Councilmember Ortiz, hopefully to bring us home here, and then we'll take a vote on the motion.
Great. Thank you, Mayor. Appreciate your input. I just want to reiterate on my motion the reduction of the fee to $0, from $50 to $0. I wanted to ask if I could get a second. I didn't explicitly say that, so I just want to make sure I explicitly say that.
Is that okay with the seconder?
Okay.
I don't know who
Thank
the
you.
seconder is. I'll leave that to Tony. Yeah. Dual seconders agree. Okay. All right. Thanks, Councilmember. All right, Tony, let's vote.
Motion passes unanimously.
Okay, thank you. So let me check in with colleagues here. It is about 5:30. We have a number of items left. Should we just keep going? Okay, I'm hearing keep going. At some point, if folks are, there's food in the back if people want to step back there. All right, sounds good. Let's keep plowing ahead then. I have now misplaced our next item. I believe we're on to item 3.4, which is we're on to item 3.4, Citywide Capital Improvement Program Annual Report.
Good evening. I'm Matt Lesh. I'm your Director of Public Works. And at present, I'm still your Department of Public Works Director. We have before you our citywide CIP annual report, which covers last fiscal year progress towards our capital construction for your capital investments. With me is Catherine Brown, the Assistant Public Works Director,